I was hopeful as the vaccine came forward that we would not see this again. However, this is reality. We are seeing this again.
Slammed and forced to delay surgeries again.
Yeah,
we've heard this story before.
Yes, we have. Hospitals had been hoping to see some relief this holiday. They say they are now in that exact same situation as last December, even with the vaccine available for everyone. So Brittany Thomason learned it has forced some hospitals to delay surgeries for patients. Brittany.
Yes, and just to give you an idea of how busy hospitals are, Valleywise Health tells me there is so little room available. Some patients are waiting in its emergency room for more than 24 hours before they're able to get a bed. The Mayo Clinic, Dignity Health, and Valleywise say if your surgery is not urgent, it could be postponed.
This continues to put strain upon our resources within the health systems and are likely going to necessitate us to make some changes.
It's a change hospitals hope to avoid this holiday, but Valleywise Health's Chief Clinical Officer, Michael White, says it's here.
We have not routinely been doing elective surgeries, which have required admissions to the hospital for a number of weeks. I suspect that's going to continue to ratchet down, where we're only going to be able to do very urgent or emergent surgeries here.
If it can wait 4 to 6 weeks without hurting a patient, surgeons are asked to hold off on the procedure. With COVID patients taking up 40% of Arizona ICU beds, other hospitals face a similar situation. A spokesperson with Dignity Health tells me it's evaluating non-emergency surgeries on a daily basis and adjusting if needed. The Mayo Clinic says it's also looking at which procedures it can safely delay. As the executive director for the Arizona Public Health Association, Will Humble says hospitals look at a spectrum of conditions when deciding what to delay.
On the extremes are things like acute appendicitis and cosmetic surgery. But towards the middle are a lot of procedures that might not be an emergency today, but that need to happen. Procedures of the heart, stents, those kinds of things.
To keep beds open, White begs people to get vaccinated.
This morning, 95.6% of the patients that we had in the hospital were not vaccinated.
Dr. White is also reminding people to get their booster shots. If you got Pfizer or Moderna more than 6 months ago, he says it's time for a third dose. Those who received J&J need a booster 2 months after their first shot. Jamie?
Brittany Thomason in the newsroom. Thank you.